Hello, everybody, from Dr. Clare, GP and medical herbalist in Sea Road in Galway in Ireland. And what I want to talk to you about today is sinusitis. I use whole herbs, whole food, whole movement, whole laughing, all of these things for getting us out of our miseries with chronic medical conditions. And sinusitis is one in particular that really sustains little sympathies and very little cure. It's one of those chronic things that people live with. And there is such a lot that we can do using natural medicines to help you with this chronic problem. People might think, oh, I've got sinusitis, or somebody diagnosed me with sinusitis. But I have to say it's a condition that I regularly re-diagnose. It sounds like it should be simple, but there are so many other things like chronic headaches, congestion without sinusitis, just nasal congestion, polyps, that kind of thing, chronic allergies, and often there's a fungal underpin, which may be one of the reasons why it really doesn't respond to antibiotics. The one way that you will know for definite that you have sinusitis as opposed to other diagnoses is if you always consistently have pain as you come into land from an airplane. All right, that is sinus pain, and if you ever had it, it's very severe. Sinusitis, chronic sinus problems can be very severe. The reason for the pain is not always infection. It's really because of expansion. It's stretch receptors and just full congestion of a bony space. And I'll say more about that in a minute. And then that can go on to become inflamed or go on to have a chronic inflammatory element to it as well. The fact is that no one dies from sinusitis, so there's very little major push for research and very little major funding. Besides which, there's plenty of money being made from over-the-counter remedies and from medical treatment, but very few of which actually get to the underlying problem and leave you in better condition than you did before you started the treatment. That's where herbal medicines are different. When it's very severe, I've had patients who just can't put their glasses on, and they can't function at work because it's just acutely tender. And that's not always with infection. That's just a pain. It can make it very difficult to concentrate or to focus. You'll know that it's sinus pain is if when you stoop over to take the dishes out of the dishwasher, just pain. Consistently with stooping over. Any kind of chronic pain, but pain in the face is particularly tiring. And the other thing is that you end up mouth breathing, and then you have no filter for respiratory illnesses, including viral illnesses like flu and COVID, which is one of the flus. So that gives you, in fact, along with irritable bowel, chronic sinusitis, irritable bowel, migraine, these kind of conditions were a big impetus for me in looking for a different way of managing health problems than the pharmaceutical route. And I took that, I made that choice 21 years ago, and I have to say I've never looked back. I did make that choice because I had an opportunity to study herbal medicine and have some of the best qualified authorities in herbal medicine 23 years ago teach me in my clinical practice. And lo and behold, my patients came back. There was no shortage of patients. It was all on the NHS. The prescription was free, the same as NHS prescriptions. The clinic was booked every week, and consistently over the 2 years associated with my studies at the Middlesex University, where I did a degree in herbal medicine, consistently my own patients that I've been looking after for 10 years kept coming back and saying, not sure what it is, but I feel better. Right. So that was like a generic thing. Then we would hone down and find out, well, what specifically was feeling better. But that was a very specific thing, which led to me changing the course of my career. So what's on offer in the pharmacy? Well, I can say categorically that when it comes to randomized controlled clinical trials, which believe me have lots of drawbacks, it is antibiotics and nasal steroids are not effective for acute sinusitis or for chronic sinusitis. The only effective product is nasal steroids in the presence of postnasal drip. Oh, here's another lovely big differential part of the differential diagnosis is a postnasal drip. So the nasal steroids can be useful for people who have chronic sinus problems and also a postnasal drip. And we can use the nasal steroids under these circumstances along with herbs, because using the steroids just means that when you stop the steroids, the problem is still there. Okay. Now, when you think about using natural medicines, the first thing you think of is, why is this happening? Okay, what's the function of these tissues that are inflamed or infected or painful, and why have they stopped functioning well? And the other thing we think about is the structures underneath all of this. So I have a highly technical educational aid here. It does look like they've been on the red eye from New York, doesn't it? So this is what our sinuses are like. They are holes in the bone. If this was solid bone in our faces, we would be bunk. We would not be able to lift up our heads and hold them up for the day. We would never have gone from 4 legs to 2 legs. That, along with hemorrhoids and problems with varicose veins, are problems yet to resolved by evolution. So we're still a work in progress. So as you can see, this is a hole in the bone. There is a mucous membrane stretched in here. There's a blood supply stretched in here. So they're pretty ropey. They're not the most well oxygenated and the most robust. So because it's all kind of pulled in from the nasal mucosa. And this is like a basin. So where would the mucus go except to sit here and accumulate? More so in some people than in others. So there's also sinuses up here. These are less frequently implicated because their drainage hole is here. So gravity, so long as they're sufficiently liquid, they will be drained by gravity. So I'll come back to this in a minute, so I must put it somewhere safe. And and then we think about what's the function of the mucus or the cells lining the mucus that work together with them. And what the mucus does is it warms the air as we come in, it filters the air, it removes dust, pollen, and germs, and it moistens the air, and it also excretes things. We produce mucus, and in that we excrete things, and that's not often addressed. So for that reason, I use a lot of cleansers, and it's a big part of why we suggest the dietary changes. So alongside the mucus cells, there are mucus-associated lymph tissue. And if you look at the whole, because this mucus here is continuous with our throats going down into our lungs at the back, and at the front going down into our digestive tract, all the way down, squiggles on those squiggles, huge surface area. So this lymphoid tissue is actually the largest lymph organ taken collectively in the whole body. And it delivers immune capacity. So all of the pollen and antigens and bugs and everything, it moderates whether we have a low response or an appropriate response or an elevated response to these things, as with hay fever. So the immune system is directly implicated in all of this. Okay. And once we have the immune system implicated, we have stress implicated, because stress has such an important effect on the immune system. So because you're the one suffering, that you can be very miserable with chronic sinusitis. And the natural medical model starts with food. And the first thing I suggest to people is stop eating wheat. People are often surprised that it's not the first thing isn't dairy. But even in the absence of allergy or intolerance, the fact that we eat so much wheat may cause overload, and the enzyme systems for wheat breakdown in the gut can't rise to the challenge. It's one of the cereals highest in gliadin, but not only gliadin, which is implicated in celiac and gluten problems. There are other proteins that have equally indigestible elements and effects on the adhesion, particularly of the mucous membrane cells. So all in all, it's relatively difficult to digest. Stay off the wheat for 6 weeks and then reintroduce. If the symptoms recur, stay off it for a further 6 weeks. If no reaction to stopping or reintroduction, return to a varied cereal diet. We shouldn't overload our diets with one cereal. If you're eating a lot of bread and having Weetabix for your breakfast, have Oatabix sometimes, or porridge, even better. We have a leaflet on the website on a wheat-free diet. If you send us your email, we'll send you all of these resources. Tara will look after you. So the second suggestion is to stop eating dairy. You may be one of the people who increase their mucus production in response to dairy. And the only way for you to find that out is to actually test it for yourself. We're the only mammal species who drink the infant food of another mammal throughout our lives. It's just another interesting way of looking at it. We have a dairy-free diet on the website leaflet. Eliminate and reintroduce as for the wheat. The leaflet mentions other sources of calcium. If you can't take them, get a supplement from your health food store or pharmacy or from us. My other little prop here is a tin of sardines. Sardines are rich in essential fatty acids, also good for the immune system and any inflammatory reaction. And because they're a bony fish, they are also rich in bioavailable calcium. Always happy to plug sardines. And inexpensive. A healthy food diet is not an expensive diet, guys. Because these restrictions for either are for 6 weeks, don't start tomorrow. Don't start 2 days before Christmas. When you go shopping, organize your cupboard, think your way through breakfast, lunch, and dinner for the next, how long it is till you go shopping again. Have a food box in your car so that if you're stuck somewhere, in Ireland especially, going to wakes and funerals, make sure you've got a goodie bag of oat cakes and various other things so that you're not caught out. Now, do you do these at the same time? If you are really miserable, and if this is your problem at this time of the year, you might do them both together, then reintroduce them one at a time. So stop the wheat and the dairy. After 6 weeks, start reintroducing the dairy while staying off the wheat. So you're trying to get a good reduction in irritating factors at the highest time of the probability of infection. I'd probably suggest something different if you're watching this in March, as it'll be on the YouTube channel. So you have to, I always encourage people to kind of think for themselves, what's going to suit you? You're the one making the decision. You're doing the shopping. You're doing the shopping and shopping. Okay. But it has to be logical. So you do your own protocol. The other thing to do if you're starting in March or April or May is you can stop the wheat for 6 weeks, and then reintroduce. The difficulty with that is you don't usually have your sinusitis until the middle of winter, so it's very hard to judge. But in general, depending on the severity, your individual circumstances, some people, it might be just a minor problem and they might decide, look, I'll just vary my diet and make sure that there's, not nearly as much wheat as there used to be, and that there are varieties of milk while keeping an eye on my calcium. Other people do the whole regime. If you want to put a kind of professional structure on this, make an appointment with either of our nutritionists. We do Zoom calls as well. So they're used to my protocol. It's actually not as simple. None of this is as simple as it looks, but it's very worth doing. That's what I would say. So the other biggie, and it's actually not on the leaflet, which is to say sugar drives any chronic inflammation up the, I don't know, some river. It really elevates. So reducing the sugar in your diet. Now, the things that people don't think of is figs and dates and prunes. So you're looking at volume, and whatever you use, make it enjoyable. I'm a great believer in enjoying the good life. It's the stuff that you think is a treat that you're having every day. And I can just say that if you're having it every day, it's not a treat, right? So it's not that you will never have a slice of birthday cake. It's not that you won't have something after your dinner on a Sunday, or if you go to a restaurant. But that volume of sugar that just keeps, it keeps everything stoked up is what I'm getting at. Now, if you're very severe pain, very severe distress, I would go an embargo on sugar of all descriptions. So we'll see how that goes for you. So the next dietary advice is lots of garlic, onions, spring onions, which we call scallions, leeks and chives, as much as you can pack into your cooking or your salads, raw or cooked, both are useful. The next suggestion is eat foods containing essential fatty acids. Again, we have a leaflet on the website. Do this on a regular basis, very important. In case I forget, hydration, very important. Drink your glass of water. I've just finished mine. Eat lots of greens as part of vegetables and fruit, 7 to 10 portions a day. A portion is the amount you'll fit on your pan. So 3 cherry tomatoes, 2 scallions or spring onions, a handful of mushrooms, courgettes, the amount of sliced courgettes that would fit on your pan. And people say, oh my God, that's a huge amount. And I say the government says a minimum of 5. So 7 is not a big uppy. And 10 is ideal, especially if you want to live healthy, to be 99 or 100 or 110. This is a good point to say. You don't only eat the vegetables that you like. You eat every color under the rainbow and every different texture. And if you don't like them, it doesn't matter. We're under the illusion in the last 30 or 40 years that we should like everything we put in our mouths. I don't like sauerkraut. I make an effort to put it in the bottom of my stew, goulash, vegetarian curry, and maybe not the vegetarian curry. My omelette, mix it in with my omelette. I just put spoons here and there, and I don't taste it. So it's no problem. There's ways around these things. The way around them, by not eating them, is not a good solution. So, why are these important? Because the flavonols are brilliant. They're in all the colored vegetables, the folic acid in the greens. There's loads and loads of good reasons. I just sneak everything in by way of vegetable soups and curries and mix everything up together, and then use the sardines as well, so that you're getting a whole variety of things. Okay. So then we go on to the specific ways of managing. Where did I put my picture? We're going back to this. So we want to inhale steam so that the steam goes in here and has a liquefying effect and an antimicrobial effect. And I'm going to show you, because you know what, guys, we've forgotten how to do all of this. So you have your basin of water bigger than this. This is just for demonstration purposes. And you can see the hot steam, and that's even been sitting there for a while. And then you put this here, and then you use a cloth. This is my colleague's scarf, which she lent me because it's a bit lighter than and then, you can put anything else in here. I have eucalyptus oil, a couple of drops. Doesn't have a dropper, so a few drops. Lavender oil, a few drops. And that's especially if you're stressed or you're having difficulty sleeping because of sinusitis. Tea tree, if it's very chronic, I would use tea tree because it's good for chronic fungal infections, and there's a growing suspicion that there's a fungal element. I can't read the label on that. Oh, it smells nice. Not sure what that one is. And then you can add, there's thyme already in here that was in the bowl, a whole bag of it. And here you are, but usually you just use 2 or 3 teaspoons, and this is the chamomile. Now, this is what chamomile looks like. Wait, let's see. How can I show you? There you go. You can see the whole flowers. This isn't chamomile dust. So one of the important things about herbs is the quality. So you squish them like this, and then you smell them. Oh, no, that smells like chamomile. If you open up your chamomile tea bag and it doesn't smell or look like flowers, you're not getting the best product. So you put your head over. And breathe in deep, right to the bottom of the lungs. And that's very calming already. So you'd use a bigger bowl, and the water will be a bit more boiling. So, and you can make up your own recipes, which I think is brilliant. I love when my patients make up their own recipes. So you've done that nasal. Okay. Oh, I've done these out of sequence. My apology. Okay. So my apologies. I'm going to go back on that, but I've demonstrated that, so that's okay. So the first thing to do is done that one, is science friction rubs. You get 2 fingers. I run a note on it, stretch the skin, and then for a few minutes. And that is a friction rub. Now, if you want that, and you can see from my cheeks that it actually makes this red, that heats the bone. So you need to do it for longer than that, until the bone is good and hot. What does a hot bone do? It liquefies the mucus. And then you use our sinus, chest and sinus rub when you're doing your frictions. And I'll tell you what's in it. You can make your own, guys, you can make your own of any of these things. Then you, and that means that when you do this, it holds on to the heat for longer. That's the biggest difference. So dry friction rubs, if you don't have a friction cream, and that cream contains comfrey cream base, lobelia tincture, myrrh tincture, capsicum oil, myrica, prickly ash tincture, and the eucalyptus smithii essential oil. So this is very good. You do it twice a day. That's number 1. Okay, I've done the inhalation out of sequence. So friction rub. So the next thing to do is an irrigation, and for that you use a neti pot. Or there is something you can get, a whole system that you can get in the pharmacy called Sinumed. So you do a salt water, just check that out on YouTube, a salt water solution in your neti pot, or you get sachets from the pharmacy that go in the Sinumed, which is a bottle. You put your nose upside down. With the neti pot, you put your nose upside down, and you irrigate the nasal passages. So that's the nasal irrigation. And then, so that's number 1, number 2, and then you do the olibus oil or eucalyptus oil, thyme, peppermint, chamomile, any of these things. You do your inhalation, okay, which I've shown you already. So we're all visual so that we remember. And then we do the postural drainage. So to do the postural drainage, we've liquefied it, given it lots of antimicrobials, some tender loving care, heated it. So now we want it to drain. So we put our heads upside down. And how do we do that? We lie across the bed. So I'm lying across the bed. The head of the bed is over this side. The foot of the bed is down here. I lie across the bed. I hang my head over the other side, and I watch my YouTube channel while my head is upside down. So about 10 minutes usually is what it takes. So this whole regime takes what, a good 20-25 minutes. How often you do it depends on how miserable you are, how much you want to avoid an acute infection, what your individual circumstances are. If it's very chronic, interfering with your life, twice a day. If it's low grade, but you want to do everything you can to change the situation so it's not a chronic misery, probably once a day. And then once you get on top of the problem, then maybe 3 times a week. So you titrate it. This is what I call individualized, personal. You're looking after your home responsibility. It also depends on how many dependents you have, whether the shopping has been done, all those things. But not looking after yourself at all is not the option. Put that one over there. The next step of the program is what I call living the good life. Regular exercise is important for your sinuses, especially out in the fresh air. And stop smoking. There you go. Just do it. Makes it sound easy, doesn't it? I'm not a fan of vaporizing. Anything that we intake into our bodies that's new takes 20 to 30 years to know whether it's going to cause problems. And at that stage, they say, oh, it's causing problems. Now we'll give you another product. So whatever ways, now, if you have a plan to vape and reduce, no problem. Everybody, I trust everybody to make the best decisions that they can. But vaping for 20 years is not a good idea. We're not designed to have sticky oils and vanilla ingested into our lungs. But is that better or worse than what we know to be extremely more toxic? These are the decisions that we make as best we can. But it's much easier to say stop smoking than it is to do it. Believe me, I know that. So for recurrent or chronic sinus problems, but no active problems, going on to what herbs are good to use on a regular basis and why. I've done all the work. I've made the formulas. You can use the formulas. You can grow the herbs, order herbs from anywhere. You can make these up. I've just made it easy for the people that I can send things to and the people that can walk in off the street. So this is because that's my ethos. That's what I like doing. So I believe in choice, that people should have a choice of having whole herb medicine available readily, and also herbal medicine consultations. So this is what has evolved over the last 21 years that we've been here. This is our congestion tea, and it's a blend of tea. You use 3 teaspoons a day. We have it like this, which is individual sachets. Each of these, you can see there's 14 sachets of tea in here. Each one of those sachets or pouches has 3 teaspoons of tea, and then it's sealed. And I pay somebody to come in and do this in the clinic. I feel that strongly about it. I also have it loose, which is less expensive, obviously. And people are free to go home, put it in their teapot, rinse out their teapots and their cafetières and their scoops and all kinds of things. I can only tell you that for 18 of those 21 years, I was saying, take the loose tea, take the loose tea, take the loose tea. Very poor compliance. This has made an enormous difference to whether people actually do it. And as you can imagine, with all of these other things that I'm saying that you can do, that you might find it useful. But we do also have it. I don't have a pouch here. We have a pouch like this, smaller, but with the tea blend, not in pouches. So that's also available. We can also send you 100 grams of any of these, or you can get them from a local supplier, or you can grow them, wild harvest them. Loving it, loving all that. So why are these useful? The thyme is antimicrobial, and in my experience over the years, it also helps liquefy the mucus. If I leave it out of the bronchial blends, particularly for people with chronic bronchitis, they notice the effect immediately. So that's my experience with it. Elderflower and plantain together are like my two go-to herbs for trophorestorative and breathing of the mucous membranes, that anti-congestion effect. Peppermint is an aromatic herb. The essential oil directly clears the airway. And it's also good for the digestion, antispasmodic. A lot of people with chronic congestion of the sinuses have digestive problems. Surprise, surprise, because it's the same mucous membrane lining the respiratory tract, going all the way down the stomach, lining the lungs, to the back, the stomach, going through to the digestive tract. So it's the same mucous membrane. There's no lines. There's no ears and throat specialist, gastroenterologist, colonologist, proctologist. There's no lines. It's all the one system. And also the mucous membranes lining the vagina it have a lot of the same characteristics. So this is good for all of the mucous membranes. So plantain yarrow is antimicrobial, a bitter herb, so it helps balance the autonomic nervous system. It helps sweating, which is another way of elimination. And the mucus itself is a form of elimination. So there's an element of cleansing, alterative blood cleansing in here as well. Rose hips have bioflavonoids and also good for very good levels of vitamin C. They're also very good for blood pressure. And then cayenne seeds. Cayenne opens up all of the peripheral blood supply and helps with sweating. So elimination is a big part of this. Not you don't go around like you've just come off the football pitch, but it's just a gentle encouragement. All of these herbs are helpful. These are the ones that I've chosen. They're common herbs for this problem, whether you go to any other part of Northern Europe and probably even further, these would be recognized and people would go, oh yeah, that's lovely, lovely, lovely. But there are lots of other herbs as well. Chamomile, particularly if you're living with a lot of stress or there's overlying digestive problems, even more than I've described, would be very good. And the other one is Echinacea. If you find that your immune system is in rag order for one reason or another, I mean, for instance, if you got sinusitis after COVID, that would be not good. And the Echinacea would be very good for that. But even if you've just had gastroenteritis or you get your infection in your fingernails or your ear, you've had shingles, anything like that, things that are, just keep adding up, then Echinacea as part of your congestion tea would be good, or you can just use drops. If you've had recurrent sinusitis for years, be prepared to use the congestion tea for at least 6 months. Okay, for the whole of the winter and into the spring, all right? And that way, when you're not being assaulted by the sinusitis, you have a period of then really clearing out and nourishing your mucous membranes so that they're in better condition before you start next winter. So herbalists look at health not just it's not just an instant pizza kind of health. It's whether is this going to resolve the problem so that you create not vicious circles, virtuous circles. So that the same works with hay fever, so that next winter it's not so bad, and the winter after that, and then like 2 or 3 years later, you kind of go, I haven't had that sinusitis for ages. It's not a big part of my life anymore. Now, the next thing we'll go on to is managing acute infections or acute on chronic infections. And the first thing I put down in here is hydrate, 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 or hydrate plus, plus, plus. So if you have any acute infection, make sure you keep up your fluids. And that's another reason why I sneak in the teas, because they keep people drinking water. So here I recommend the Mucotone. I'll say we also have a congestion blend as a tincture, which has a lot of overlapping, but it's much more expensive. And I always give people the solution that I think is practical, the lowest cost, giving them the most options. But some people just won't use the tea, so then I use the congestion. Or some people find that I used this once when after a cold, it just didn't settle. And I kept getting this bubbly bubble wrap feeling in my ear. And eventually I thought, no, I think we have something for that. And I started using it. Within 3 days, it was gone. And then I stopped using it. And after about 4 or 5 days, it started to come back again. And I thought, now, Dealish, that's exactly what you tell your patients not to do. Always take the herbal blends, any concoction of them that's doing the job, and always take them for a bit longer than just as the symptoms stop happening, because you want a little bit of an insurance policy afterwards, and it gives the body a chance to really not slip backwards. So that was me not taking my own advice. So the mucotone is from, now here's the important bit, the first indication. This goes even if you're just using Echinacea by itself. The moment you go, uh-oh, I'm coming down with something. Everybody has their own sensation or awareness. For me, I get a tingling in my soft palate, where I'm going, it's just annoying. Other people, their nose starts dripping. Other people get a bit of a sore throat. Other people get a shivery, achy feeling down their spine. Other people, they get muscle weakness, with their arms, they just kind of go, just doesn't feel right. And they kind of go, oh, I bet I'm going to get a cold over the next couple of days. And by itself, the cold isn't a problem for most people. It's not very pleasant. I still advise them to use the herbs. But if you know, oh God, when I get a cold, that's it, the sinusitis, I'm going to be sick for 6 weeks. And just not fun. So mucotone, and I'll tell you the herbs that are in it. And it's all on the website. All of those are easily available. So thyme, echinacea, ginseng is very good for acute infections, for actually mobilizing what resources we have. Mallow, soothing and nourishing for the mucous membranes. Iceland moss, similar. And in Ireland, we use carrageen moss as well, carrageen seaweed. And then cat's claw is very specific for the immune system, and there's a lot of overlap with echinacea. And then licorice, which is an adrenal tonic, and we have that as a syrup because it's also very soothing, and a good adrenal support and demulcent, and good for a cough. All right, so that's why that's in there. And then garlic, you probably know it's very, very antimicrobial, and it has sulfide bonds which break down mucus, very, very specific for all of this mucus stuff, and ginger. And ginger helps disperse all of these goodies through all of the tissues, and it's also digestive. So the licorice is digestive, the garlic is digestive, the Iceland moss is all digestive. So I'm treating your digestive tract even though you don't know it. You think you're taking them for the sinuses, and I'm kind of going, that's just a nice little overlap. So if a bout of sinusitis is triggered by stress, or when people get used to get familiar with how to use the herbs for their family medicine, they know what level of stress it takes, and they're going, oh, I know if I don't, they're busy, they're caring for parents, they're doing homework with kids, they're doing their masters on top of a full-time job, all that kind of thing. And then there's the one deadline, and they know, oh, I bet I'm going to, the final deadline, and they go, oh, I bet I'm going to get sick after this, which is when the nervous system goes from one level of activity to another, and the immune system gets wiped out in the process. That's when I suggest to people that they use the herbs in Relax Blend or Tranquility Tea. I won't go into the full, that's all on the website. So again, I've done, when I came to Galway 21 years ago, we had a whole, it's over the other side of the clinic here. We had a whole dispensary of liters of herbal medicines. And people would come in and say, well, what do I take for this? Or what do I take for that? And my staff weren't trained herbalists. They're trained as herbal dispensers. But they didn't have the training to put together blends of herbs, or that level of knowledge. So gradually I got together a whole range in response to what people asked me about, like sinusitis, chest infections, irritable bowel, provided they'd had it all checked out with their doctors, they'd had already ready relevant investigations, they tried everything. Usually they've tried everything else in the pharmacy. So they just dispense them from behind the counter. And then over several years, I had one patient who kept coming in and saying, you really should have those labels on those so people know you have them. And I'm going, oh, yeah, I must do that. I must do that. And one day she came in and had all the labels done for me on a floppy disk. That's how long ago it is. They've all arisen not because I'm clever, because these are derived from a range of formulas of common practice, safe herbs overlapping with food. They're all also foods in here or in other cultures. So they're very safe. They're complex. And they're multi-purpose, multi-action, multi-constituent. So that's why they have such rounded effects and nourishing effects as foods. So you've got an acute flare-up, either on chronic or just independently. Sometimes people just get 2 or 3 or 1 episode of sinusitis per year, but it's pretty awful when you have it. So you're hydrated, you started the mucotone. If you were very clever, you would have got the relax in from the very beginning. And then we revisit the steps for the nasal treatment system and undertake conscientiously. So that's where you go back and do the sinus friction rubs, the nasal irrigation, the steaming, and then the postural drainage. So I always have to be careful to do them in the right order, because that's how they make sense. So we've done what's in that inhalation, right? So then we go on to the postural drainage. We've done that. So then we take vitamin C daily. The dose is based on your tolerance, so of a saturation dose, and you can work that out when you're healthy. And again, if you send your email to support@drclare.net, we will send you all of the materials, including an individual, because that's useful for if you've got an infection of any kind. And the last thing is to take, if you've got acute infection, to take a garlic supplement. You can take 5 cloves of garlic a day, 3 to 5 cloves a day, but I can't do that. I don't expect you to either. But if you want to, go ahead. And my last comment at the end of all of this is, I never said it was easy. So being practical, you want to sit down with a piece of paper and write down how miserable you are, how much it affects you on a daily basis, how often it affects you, and what level of actions you want to take, how you want to organize the wheat and the dairy. I'll just say a few words about that. The wheat and dairy are very much a background thing. I had one patient who had very severe sinusitis, along with neck pain and various other things. Over 9 months to a year, everything was getting better slowly. He was full of complaints. And he wasn't giving me any big brownie points for all of this, but gradually he was getting better and better and better. And then he came to one appointment and said, Dr. Clare, I have it solved. I've stopped wheat. I reminded him that the first thing I had said at the end of the first consultation, I showed it to him written down was stop wheat, which he did, but it didn't make any difference, according to his experience, which is the most valuable experience there is. And with much humping, he went back on his wheat. And what that means is, my interpretation of that is that he needed a lot of clearing gradually, and healing of background microinflammation and gross inflammation, in order for the difference in the wheat to be a recognizable difference, a palpable difference between an acute being on wheat and stopping the wheat. So I would suspect that if he had stayed off the wheat from the very beginning, that all of those things would have got better more quickly. So, and even unfortunately for him, he was so annoyed at it not making a difference that he actually went back on a full amount of wheat. So the amount of these proteins, of gliadin and related proteins, it's a dose effect. So the more you have, the bigger a barrier it is to you feeling well. And I would say the same about sugar. So you do what you can. It's very difficult. We have a very sugar-relicious society, so it's very hard to work a personal plan into that in a consistent way. As always, I just say to people, the best way to change our habits is to do so from a kindness and compassion to ourselves, a responsibility for our own health, but interpreted in a kind and compassionate way. Okay. So if you've lasted this long, guys, you've done brilliantly. I thank you for your attention. I hope it's helpful, and let us know if there's anything. What do you think about mullein? Mullein is excellent. Another comment. Oh, I didn't know I had a live audience. You're all very welcome. I've just noticed. Vildred says every time she drinks milk, her nose goes snotty. Okay. Anyway, and somebody else is late, Tim Yerlengia, but no worry, you can watch it later. So brilliant. This is my first live one, direct to YouTube, so it's been a blast. Mind yourselves, take care.